today's video, I want to talk about anxiety and how the people who suffer from it are perceived by society, what type of anxiety I have, and what type of treatments I have underwent. I'm going to talk about a specific subset of anxiety called agoraphobia. Agoraphobia is the fear of going outside. Every person has their own reason for the fear. Each case is unique. What drives a person to fear going outside? One of the causes is fear of having a panic attack in public. A panic attack is the sudden feeling of impending death, accompanied by either dizziness, shortness of breath, and or feelings of unreality. Panic attacks can last from minutes to hours. People who have suffered a panic attack for the first time usually call the emergency services. Prolonged anxiety may cause physical pain, such as lasting headaches, migraines, dizziness, and nausea. Agoraphobia can develop from a traumatic event, which may result in disassociation, depersonalization, which is a feeling of disconnection from one's self, and derealization, a feeling of disconnection from one's surroundings. That's one type of agoraphobia, one which I suffer from, where I worry going outside for the fear of having a panic attack in public. I have had issues with finding a job and have developed depersonalization from a traumatic event I have suffered 3 years ago. The treatments I have pursued in the last 3 years were exposure therapy, where I go outside regardless of the amount of fear I have. It had some positive effects on me, but I was still experiencing headaches, dizziness, and nausea. The physical pains were a massive obstacle for me. If I went outside of my comfort zone, which is my house and the surroundings, the pain would spike and I would fear passing out. I have never passed out, so I'm unsure if it's an irrational fear. I did not have any support from my family. Most of them misunderstood what it was and thought it was an excuse for not finding a job. Unfortunately, mental disorders in our society are highly misunderstood. A person who has not suffered from one will think you are making things up. There is little to no awareness of what a mental disorder is. People are worried of being ridiculed for admitting to have a mental disorder. It is a shameful thing to be mentally ill in our society. We hide this as if it is a weakness. Yet, when you have a physical disability, people tend to understand it. They can see the problem. With mental disorders, it seems like an invisible problem, one which you are making up. People who have not gone through a mental disorder might not understand it. Most humans tend to have the mentality of, if I don't see it, it doesn't exist. It applies to most mental disorders, not just agoraphobia. Psychology is still in its diapers, and a lot of it is trial and error. The medications used for depression, such as SSRIs, SNRIs, and others in the reuptake inhibitor families, have varied results in each person. Depression is believed to stem from lack of the hormone serotonin in the brain. It acts as a neurotransmitter in the brain. Serotonin is also present in the digestive tract central nervous system, pineal gland, and blood platelets. SSRI stands for Selective Serotonin Reuptake Inhibitor. Simply put, SSRIs are believed to work by increasing the serotonin levels in the brain by reducing the absorption rate of serotonin in the sending cell, so the serotonin stays longer in the receiving cell, thus increasing the levels of serotonin in the brain. SSRIs are used to treat depression, generalized anxiety disorder, OCD, eating disorders, and stroke recovery. It has also been used for treatment of depersonalization, disassociation, and derealization, with poor results. Psychology is seen as a pseudoscience due to the poor way it treats mental disorders. The medications are overly prescribed and yield very poor results in most cases. But each science has had a starting point. I started taking SSRIs 2 months ago with some mixed success. SSRIs tend to have a lot of side effects, which is in itself an entire video. The SSRI I took is called serotonin. There is an adaptation period of SSRIs, and the first week on it wasn't bad but very unpleasant. After 2 weeks, it started taking an effect. I have noticed a drastic fall in anxiety levels. I could easily go outside without paranoia or fear of passing out. I also noticed a big difference in the physical pain levels, reduced headaches, nausea, and dizziness. The side effects I had were insomnia and a slight increase in derealization. It did nothing to help my sense of unreality, but it was secondary to me. I can handle the feelings of unreality. The physical pains were what stopped me from being an active member of society. Due to my insomnia, I was constantly tired during times I was awake. I would lay in bed for hours upon hours without achieving anything, but it was a relief from 7 years of constant headaches. I wasn't as scared from getting a job as well. After a month of use, my therapist decided to change my medication to an SNRI. The insomnia was very severe, where I had few hours of sleep and many hours of simply lying in bed with my eyes open. SNRI stands for Serotonin Neuroadrenaline Reuptake Inhibitor. It works similarly to an SSRI, but it also affects neuroadrenaline. The SNRI I take right now is called Miru. I've been on it for 2 weeks so far. The first week was rather unpleasant, with slight nausea and headaches. So far, I'm feeling better mentally and physically. I don't have side effects I'm aware of. The insomnia is gone, and the headaches, nausea, and dizziness are now at a low level. The depersonalization is still high, but the anxiety levels are lower than what I have started with. My mentality on antidepressants is that they're not a cure, but rather a temporary bandage you use to overcome your fears. You use them to get over the fear of doing an activity, and once you are used to that activity and see it is not as bad as you thought it was, you can start tapering off the antidepressants to see how well you deal with that situation. I'm still in the process of adapting to the SNRI, so they're still not fully active as of right now. Well, okay guys, I hope you enjoy this. Have a good night.